If you've been waking up with stiff, swollen joints and you're wondering whether it might be rheumatoid arthritis, you're not alone. And in 2026, you don't have to wait weeks for a doctor's appointment to start getting real answers. You can order the same RA blood tests doctors use, online, without a prescription, and walk into a lab the next day. In this video, I'll walk you through which tests actually matter for RA, what they really tell you, what they cost this year, and exactly how to order them. I'm not a doctor. I'll keep this honest and tell you where a doctor still belongs in the picture. Rheumatoid arthritis is an autoimmune disease. Your immune system mistakes your own joint lining for a threat and attacks it. That's what causes the swelling, the morning stiffness, and over time, joint damage. Blood tests can't diagnose RA on their own, but they're a huge piece of the puzzle. A rheumatologist combines blood markers, your symptoms, and sometimes imaging to make the call. Ordering blood work first is a smart, low-cost way to bring real data into that appointment, instead of showing up empty-handed and waiting another month for a follow-up. It also helps rule things out faster. There are 4 blood tests that show up on almost every RA panel. First is rheumatoid factor, or RF, an antibody elevated in roughly 70 to 80% of people with RA. Second is anti-CCP, also called ACPA. This one is much more specific to RA than RF. Third is C-reactive protein, CRP, which measures active inflammation in your body right now. Fourth is the ESR, or SED rate, another inflammation marker. A solid RA panel includes all 4. Some panels also throw in a CBC and ANA to help rule out other autoimmune conditions like lupus, which can mimic RA early on. Here's the honest part nobody tells you. RF can be positive in totally healthy people, in hepatitis C, and in other autoimmune diseases. So a positive RF alone doesn't mean you have RA. Anti-CCP is much more specific. If it's strongly positive, that's a serious clue. CRP and ESR tell you inflammation is happening, but not where or why. The pattern matters more than any single number. A negative RF doesn't rule RA out either. That's called seronegative RA, and it's real. Bring your full results to a rheumatologist. The interpretation is genuinely what you're paying them for, not the draw. In 2026, here's roughly what to expect. A standalone rheumatoid factor test runs about $30 to $45 at the major online lab services. Anti-CCP is usually $50 to $70. A full RA panel bundling RF, anti-CCP, CRP, and ESR typically lands between $90 and $160. Add ANA and a CBC to screen for other autoimmune conditions, and you're looking at $150 to around $250 total. Compare that to going through insurance. Same lab, same blood, but you might be staring down a deductible. Cash pay through these services is often cheaper than your actual copay. Ordering is genuinely simple. I'll drop a link in the description to a service I've used. Step 1. Pick the RA panel on the site, not just a single test. Step 2. Pay online, usually under $200. Step 3. You get a lab requisition by email, usually within minutes. Step 4. Walk into a partner lab. Most use Quest or LabCorp. Show the requisition. Get your blood drawn. No appointment needed at most locations, but checking ahead saves time. Step 5. Results come back to your account, usually in 2 to 5 business days. That's the whole process. You don't need to fast for the basic RA panel. RF, anti-CCP, CRP, and ESR don't require it. If your panel adds a metabolic panel or lipids, then yes, fast for 8 to 12 hours, water only. Bring a photo ID and your requisition, printed or on your phone. The draw itself takes about 5 minutes. 1 or 2 small tubes. Stay hydrated the day before. It makes the stick easier. If you're on biotin supplements, stop them at least 72 hours before. High-dose biotin can skew some immunoassay results and give you a misleading number. Most people completely miss that detail. When results land, you'll see each marker with a reference range and a flag if it's high. Don't panic at a single red number. Look at the pattern. Is anti-CCP positive and is CRP elevated? And do you have morning stiffness lasting over an hour? That combination is meaningful. A lone elevated RF with no symptoms and normal inflammation markers is much less so. Screenshot your results, write down your symptoms with dates, and book a rheumatologist. The lab gives you data. A specialist gives you a diagnosis. Do not start any treatment based on a number alone. That's where this approach gets genuinely risky for you. A few situations where you should not be DIYing this. If you've got significant joint deformity, unexplained fevers, weight loss, or symptoms that came on suddenly and severely, see a doctor first, not a lab kit. If you're already on immunosuppressants or a biologic, your monitoring should be coordinated with your prescriber, not freelanced. And if results come back strongly positive, don't sit on them for months. RA causes joint damage that doesn't reverse, and early treatment changes outcomes meaningfully. Use online testing as a faster on-ramp to specialist care, not a replacement for it. Speed matters here more than saving a copay.